Greetings! I'm back again with another video in my series about practical or common sense neurology, and today I'd like to discuss what will happen when a family member has a stroke. So simply put, a stroke occurs when a blood clot blocks an artery in the brain, and that ends up producing a neurological deficit that corresponds with the portion of the brain that is affected. Usually part of the body is weak or numb. The first thing that will happen in the emergency department is they'll assess the candidacy of your loved one for one of two treatment modalities. One would be the administration of a clot-busting medication, historically alteplase and more recently tenecteplase, to dissolve the blood clot in place. The other is a surgical procedure called a thrombectomy, wherein a device is threaded up into the brain and removes the blood clot itself from the artery, thus restoring blood flow to the affected portion of the brain. Once that decision is made as to whether they are a candidate for those procedures or not, they'll then be admitted to the hospital for further workup and recovery. While hospitalized, the first thing you might notice is that they are listed as being NPO, or nothing by mouth. The reason for this is quite straightforward. A stroke can affect the muscles in your throat that you use to swallow both solids and liquids, just the same as it can affect the muscles in your body. And if you were to try and drink or eat when those muscles are weak, you could ingest some of those particles into your lungs, a process we call pulmonary aspiration, and that can lead to a very nasty form of pneumonia called aspiration pneumonia. And so that's why we'd ask that your loved one not eat or drink anything until they've had that swallowing ability formally assessed. On that same note, we'd ask that they stay in bed until a physical therapist can assess just how safe they are on their feet. The last thing we need to do is add insult to injury and cause another injury to the patient by falling and perhaps striking their head. While admitted, the cardinal thing we're going to do is look for reasons why the patient may have had a stroke. This entails a lot of imaging of the brain. For example, do an MRI of the brain. They'll do angiography. This is the assessment of blood vessels in the head and neck. An ultrasound of the heart. They'll monitor his or her ECG with telemetry monitoring, and do some basic blood work to look for things like high cholesterol or diabetes. There are some other studies that'll be done in more exotic instances, but by and large those won't be necessary and are beyond the scope of this lecture. Once those risk factors are identified, both the treating neurologist and internal medicine doctor will come up with a medication regimen designed to prophylax against and treat those risk factors, a process called secondary stroke risk factor prophylaxis. By then, your loved one will probably be ready for discharge, and one of two things will happen. One, their deficit may be resolved, or they're so mild that it's safe to go home, or it may still be substantial enough that they're not safe at home, in which case they'll require admission to what's called a rehabilitation hospital, where they can work with physical, occupational, and speech therapists on a regular basis to regain that strength and function. This sometimes could take weeks or months. It just depends on the severity of the deficit. And that is, in a nutshell, what will happen if someone you know or love has a stroke. If you have any questions, please don't hesitate to ask. If you like this video, please go ahead and like, comment, or subscribe, and I look forward to seeing you again. Thank you very much.